Infection prevention. This is something that we take a little bit too lightly, whether it be in healthcare, whether it be at home and anywhere. And I don't use the word control. And the reason for that is 20 years in this business. I'm a very reluctant entrepreneur. This company actually is run by a co-director of mine, Patricia. I generally faff around the whole place. We don't sell products and services, contrary to what most companies will tell you. We only do solutions and experiences. We are a totally custom engineered based company. So there are no standard products. There is nothing. There are no brochures that you shall find around or nothing like that. We give custom engineered solutions to the industry. So that's what we are. And commercial presentations are not my forte, so I'm done with that. So let's talk about these good-looking beings, okay? They're around you everywhere, which you all know. They're getting good-looking day by day thanks to lovely photography. Somebody told me about, I want to go back to roots. Somebody from California. And then a lady from Tata Memorial showed me this slide. That we started in 2000 BC from here, eat this root. And the beautiful part is through this journey of this pill and penicillin and tetracycline and so many more antibiotics, we are back to here, take this root. Because none of them seem to work anymore. So I don't know what we are doing in terms of the antibiotic story. This is a list that I can update almost every day. And last month, thanks to Nika, I was getting about 50 phone calls a day asking how to protect ourselves. That's where we are currently. We don't know how these microbes are behaving even today. This is something from the British Prime Minister's office, which says antimicrobial related deaths in 2050 will be 10 million, 20% more than cancer. Not me, British Prime Minister's office. GDP loss is about 100 trillion. Okay, I don't understand trillion, but must be a large figure. We all talk about hospital-related infections. We need to move on to healthcare-related infections because healthcare is not delivered anymore in hospitals only. There is home, there are so many more. Earth could control 1 trillion microbial species, but humans know only 0.001% out of that. So 99.999% of microbes are yet to be discovered. So conditions and standards. Now, thanks to our pharma industry, where we don't go around checking how they are manufacturing it. They've got great manufacturing facilities. But can we say that about some of our medical device industry? May not be. This is a typical clean room looks like, and that's where the product should be manufactured. Because if you are getting a mask that is made, or a surgeon gown, or a drape that is made in unhygienic conditions, you don't know what viruses and bacteria you are getting into your OT. You have no idea. You have no way to find out. So clean rooms, monitoring of air quality and storage conditions, batch-wise, raw materials, finished goods as per standards, packaging validation. I say this with humility, but most of our ETO sterilized goods in India are packed in plastic packets. It's a wonder how ETO goes inside it, and even more wondrous is how does it come in outside. You will see gauzes packed in LDP plastic covers, what we call plastic, polyethylene or maybe covers as they are called. How does ETO gas penetrate? And even if it does, how does it come out? It's not made out of polymers that have memory. Those will cost 10 times more than the product. But it is happening. Look around you. Don't believe what I see. See around you if it is still happening. Medical packaging is not being used in these. Sterilization validation. Changing color on top is no indicator of that. It's just a process indicator. Nobody does ETO validation in the country. There are very few companies who do. 10, 12, 15, 20 maybe. But yes, our pharmaceutical and our higher end products, they are world class in that. We need to also. Just because it's a 10 rupee, 20 rupee, 100 rupee product does not mean it is not validated. It's a carcinogenic gas. residue testing, bioburden testing, traceability, tests for irritation and skin sensitization, biocompatibility. Now, these may all sound like international standards, but they are not. They are all part of the Indian Medical Device Regulatory Act, which is in principle on from 1st January 2018. And all this is part of it. There are 500 plus medical devices that are part of it. The chain is only as strong as the weakening link.